Well, in just over an hour, President Trump will leave Walter Reed Hospital despite doctors warning he's not yet out of the woods.
Crowds who've gathered outside that hospital are excitedly standing by, ready to catch a glimpse of their president a day after his surprise drive-by, which was slammed by medical experts. Joining us now with more is physician and former US Congresswoman Dr. Nan Hayworth in New York. Thank you so much for your time, Doctor. Health professionals have slammed that drive-by. One doctor inside Walter Reed saying the irresponsibility is astounding. Do you think the same?
Dr. Phillips actually is not anywhere near the team who is actually caring for President Trump, I'm happy to say, but it sounds as though he may have been adjunct faculty. He has a particularly negative view. The good news is for all who care about the health and continuity of the American government that President Trump has benefited greatly from the therapeutics that he has pressed since the very beginning of this pandemic. So with the most meticulous of care and a fairly activist approach, it sounds very reassuring. And I'm saying that not because I have any inside information, but as a physician who has both practiced and worked with the industry that's producing some of these miraculous interventions.
But does Dr. Phillips have a point in the sense that COVID-19, as we know, is highly contagious? The president was in the back of a vehicle with the windows up, so an enclosed space, with his security detail. That doesn't sound very responsible.
Well, I don't think it was irresponsible at all, and here's why. The president has a security detail in his quite immediate vicinity at all times, as you can imagine. So for them, they are very well versed in the kind of protective measures that will prevent them from acquiring an infection in the same way that the medical teams who are taking care of the president, the entirety of the staff, are all meticulously protected. And if you look at the images from the president's drive, the Secret Service agent who was directly in front of him was wearing an N95 mask. So a well-fitted N95 mask is considered protective. So I do feel very strongly and confident that the president posed essentially no risk to these security detail agents.
I wanted to talk to you, if I can, about these experimental drugs. He seemed to have jumped through quite a few hoops to get them. He's the president, after all. Typically, they're reserved for more severe cases and can have, we hear, huge side effects. As a physician, are you concerned he's more sick than the White House is letting on?
No, I'm not. I think they've been pretty forthcoming with the information. And of course, those of us who are in the profession can infer certain things, not only based on what they tell us, but also what we observe when we've seen, the president has made several videos that he could not possibly have made if he were deathly ill. And I'm happy to say that. There's little in the way of risk from the antibody cocktail infusion that he received. That's an investigational therapy, but one that has been offered to patients across the country. Yes, generally those who are in hospital with a more severe condition. But again, they are, because he's the president, because we do need him to be at the head of our government, their threshold was lower. But you can infer from that the risk was also low as well. Same with remdesivir, which is meant to prevent the replication of the virus. Dexamethasone in and of itself is a very familiar agent. It's been around for decades, used for various kinds of inflammatory conditions. And it sounds as though in each of these situations, they carefully weighed potential risks and benefits. And yes, did they take an aggressive approach with the president? They did, but I don't think it was because he was imminently in danger of cardiovascular or respiratory collapse.
Yeah, it certainly seems to have hope. He's bounced back very, very quickly. And just very quickly, do you think this will help his re-election campaign?
You know, I do think that it proves his stamina and his fortitude. And again, it proves the remarkable value of just what he's been talking about with the American public for all of these months, which is that therapeutics are very important to our approach to COVID. And for patients who do become quite ill, we have those therapeutics. His government has worked very, very hard to make them available, to make the research proceed as quickly as possible, as smoothly as possible, make them available across the country.
OK, well, thank you so much for your time this morning. We appreciate it.
Thanks, Doc.